This training is from the ACL Guidance to the Aging Services Network. Outreach and service provision to Holocaust survivors. This guidance provides state units on aging, area agencies on aging, and local service providers with information about and guidelines to consider when performing outreach to and serving Holocaust survivors. It is issued in fulfillment of the requirement in the 2016 reauthorization of the Older Americans Act, which states that the Assistant Secretary for Aging shall issue guidance to states that shall be applicable to states, area agencies on aging, and providers of services for older individuals with respect to serving Holocaust survivors, including guidance on promising practices for conducting outreach to that population. The Holocaust and Nazi persecution. The Holocaust was the state-sponsored persecution and murder of the Jewish people by the Nazi regime and its collaborators between 1933 and 1945. The systematic attempt to eradicate the Jewish people was referred to by some Nazis as the final solution to the Jewish question. The brutality Jews experienced during the Holocaust was comprehensive, systematic, and multi-leveled. Jews were first dispossessed of their property and deprived of their livelihoods. Their homes, real estate, and businesses were seized, and their synagogues burned. Additionally, they were subject to beatings, humiliation, and public hangings. As the Holocaust progressed, Jews were put on trains and sent to sealed ghettos where poverty, starvation, and lack of sanitary systems took the lives of many. Those who experienced difficulties because of age, illness, or other vulnerabilities were shot. Others died from the lack of food, water, and ventilation on overcrowded trains and in ghettos. Later, many Jews were sent to concentration camps where they were subjected to torture, starvation, and exposure to the elements. In some cases, physicians conducted experiments on Jews that included, but were not limited to, exposure to hypothermia and mustard gas. To complete the final solution, Jews were murdered in fields, in mass shootings, and by mobile killing squads, and ultimately in gas chambers. In total, 6 million Jewish men, women, and children were killed, 2/3 of the Jewish population in Europe before World War II. The Nazi regime was also responsible for the persecution and death of an additional 5 million non-Jewish victims, including homosexuals, Jehovah's Witnesses, Slavic people, people with disabilities, communists, and socialists. Who are Holocaust survivors? More than 200,000 Jews found refuge in the U.S. during the Holocaust. Another 137,000 Jewish refugees settled in the United States from 1945 to 1952, and more came from Europe and the countries of the former Soviet Union during the subsequent decades. Time, age, and the lingering effects of trauma have taken their toll, and today it is estimated that between 100,000 and 130,000 Holocaust survivors remain in the U.S. The youngest are 71 years old, but most are much older. While the size of the survivor population is decreasing, the number of survivors needing and seeking assistance is increasing. Many factors may be responsible for this trend. As survivors age and become more frail, many who did not need assistance previously now need help to get through their daily lives. The death of a spouse or caregiver can create the need to find alternate sources of care. Some communities have seen an influx of Holocaust survivors moving to an area where social services are more prevalent. Many people who did not previously identify as a Holocaust survivor are coming forward as programs to help them are publicized. Poverty is a significant concern for many Holocaust survivors. It is estimated that 25 to 50% of Holocaust survivors live at or below the poverty line. These low-income survivors struggle to meet their basic needs for housing, food, and health care, and often rely on supplemental security income, energy assistance programs, home-delivered meals, and other programs in order to obtain the basic necessities of life. In some cases, poverty can be a triggering event for survivors as it can remind them of experiences of deprivation during the Holocaust. Trauma's impact on service needs. While each survivor has unique experiences, virtually all have significant, often prolonged exposure to traumatic events as children or young adults. Cumulatively, these experiences can magnify the challenges of aging for survivors, creating a group that ages differently and has more acute needs than do other older Americans. The following physical, emotional, and cognitive challenges can be traced directly to trauma experienced during the Holocaust. Constant threat of death, exposure to extreme violence, prolonged physical, mental, sexual, or medical abuse, extreme deprivation, thirst, and hunger, dehumanizing treatment, exposure to unbearable weather, lethal hard labor, extermination of entire families and communities, guilt over surviving or inability to save others, immigration to new lands. Survivors may be especially vulnerable to changes associated with the normal aging process because former coping strategies such as hard work and taking care of the next generation are no longer an option. Illness, dementia, frailty, dependency, isolation, and loneliness may disrupt daily activities, and traumatic memories and unresolved losses might become more dominant. Signs of illness or weakness may be triggering events because during the Holocaust, those who exhibited any sign of weakness were often executed. Public health experts agree that overall health outcomes for older adults who age in place are often better than for those in unnecessary or premature institutional care. However, the negative impacts of leaving one's home and entering a nursing home or residential care community are further exacerbated for Holocaust survivors. For survivors, removal from one's home can have added meaning as the loss of autonomy, control, and independence can be reminiscent of similar losses experienced during the Holocaust. For example, admissions procedures, uniformed staff, medical personnel and procedures, showers, regimented schedules and routines, loud sounds and voices, restrictions to movement, the lack of privacy, and even waiting in line for food can all trigger memories associated with the Holocaust. For these reasons, enabling and empowering survivors to live safely in their own homes and communities for as long as possible is a fundamental goal of Holocaust survivor programs and is in keeping with the mission and purpose of the Aging Services Network. When reaching out to and serving Holocaust survivors, it is critical that it be done in a manner that minimizes triggers and reduces the risk of re-traumatization. Using person-centered approaches can help to achieve these goals and greatly improve the overall quality of care and quality of life for survivors. Person-centered care takes into account the individual's experiences, needs, strengths, preferences, and goal. This approach is based on beliefs or assumptions that 1. People are experts in their own lives. 2. Everyone can express the preference and desire that describe the way they want to live. 3. Everyone can lead a full life in their own community. And 4. Communities and families have an impact on the well-being of its members. Holocaust survivors can experience a host of mental health issues which may or may not present until later in life. Researchers have found that survivors tend to report less satisfaction with their lives and perceive their life events as more stressful compared to a matched group of adults. Survivors also have a higher incidence of post-traumatic stress disorder. Anxiety and sleep disorders, such as night terrors, have been directly attributed to their experiences during the Holocaust. Survivors can also experience separation issues, an obsession with death, excessive guilt, and may be at increased risk of attempting suicide in later life. Additionally, as survivors lose spouses, friends, and loved ones, they can quickly become isolated and lonely. The absence of social supports can also contribute to the decline in a survivor's overall psychological well-being. However, survivors are not likely to seek out mental health services, either because of distrust of medical professionals or because of fears related to stigma or institutionalization, both of which can make them hesitant to even accept help if offered. The risk of dementia may be even greater for Holocaust survivors than for the general population. Dementia increases the need for medical care, adequate housing, advanced planning, and protection from abuse and neglect. Survivors with dementia may experience frequent nightmares and flashbacks to their experiences during the Holocaust. In general, Holocaust survivors tend to prefer individual therapy when possible and prefer to receive it in their own home. Home-based therapy can help to reduce possible triggers that may make a survivor more anxious or fearful. Professionals should anticipate that it may take longer than usual to develop trust and openness with the survivor. Furthermore, as survivors are often hesitant to express weakness, including mental health issues like depression or anxiety, caregivers should continue to monitor the mental health status of survivors even if the survivor does not report any mental health issues. Socialization is critical to maintaining supportive relationships and helps to minimize social isolation and the negative emotional and physical health consequences associated with it. If a survivor is unable to attend socialization programs, friendly visitors in their home and a companion provided by the local Agency on Aging can be beneficial. In addition to mental health complications, prolonged periods of deprivation, starvation, confinement, and abuse experienced during the Holocaust have placed an enormous burden on the physical health of survivors. Physical health. In addition to mental health complications, prolonged periods of deprivation, starvation, confinement, and abuse experienced during the Holocaust have placed an enormous burden on the physical health of survivors. Chronic health issues include heart conditions, foot problems, osteoporosis, insomnia, headaches, gastrointestinal issues, hearing loss, painful dental problems. Many survivors struggle to perform activities of daily living, such as bathing and eating. By the year 2020, it is estimated that 52% of all survivors may need disability-related assistance due to normal declines of aging, combined with health problems associated with their experiences during the Holocaust. As described earlier, a number of German doctors conducted painful and often deadly experiments on thousands of concentration camp prisoners without their consent. Because of involvement with or knowledge of these experiments, some survivors have a general distrust of most medical personnel. While all individuals can experience anxiety and fear when undergoing medical procedures, these situations can be particularly traumatizing to individuals who are also Holocaust survivors. Healthcare providers should understand that Holocaust survivors may take longer than an average patient to trust their healthcare providers and to openly discuss physical health issues. When working with survivors, it is critical that professionals establish a survivor's preferences and comfort level for any procedure, care routine, and/or home support as early as possible. Once known, these preferences should be honored to the greatest extent possible, as this can provide the survivor with a sense of empowerment over the medical process. Additionally, it is important for providers to collect thorough medical histories of physical ailments from before, during, and after the war, while being cognizant that asking for this history can trigger traumatic events. Always allow ample time for the survivor to ask questions and express concerns. Medical professionals should fully explain the survivor's options as well as the details of any procedure. Providers should recognize that inpatient care can be alarming for some survivors, and hospitalization should be avoided unless a survivor cannot receive adequate care at home or on an outpatient basis. If the survivor must be admitted to the hospital, service providers should look for ways to reduce stress from potential triggers and consider offering temporary supportive services such as companionship. As a direct service provider, you can help explain medical procedures, listen to their concerns, and offer support. Foods can be a triggering event. Food holds a special significance for survivors who often faced hunger and starvation throughout the Holocaust. Whereas food security is important for all older adults, survivors have a complex emotional and psychological relationship with food. Behaviors like hoarding or hiding of food in pockets or purses are common and are more frequently observed in survivors than among other older adults. Survivors may also experience panic when they begin to feel low blood sugar or hunger pains. Survivors may ingest old or spoiled food as opposed to disposing of it properly as throwing away food can sometimes be a triggering event. Food, and meals in general, play an important role within Judaism, both in terms of its preparation and its symbolism associated with Jewish holidays. Many survivors keep kosher, which means that they need both prepared foods and groceries that are certified as such. Kosher foods can often be expensive or difficult to find for service providers and may pose additional considerations for preparation and serving. Additionally, Jewish holidays can be particularly emotional for Holocaust survivors who often have painful memories surrounding holidays and few remaining family members with whom to celebrate. Subsequently, survivors may need or have a perceived need for more or specific foods during the Jewish holidays. In some cases, obtaining food can serve as a trigger for survivors, reminding them of the painful experiences they underwent when deprived of food in ghettos, concentration camps, in hiding, or in the wilderness. Waiting in line to receive food, either in a cafeteria, congregate meal site, or food pantry, and signing up and receiving services such as home-delivered meals or SNAP benefits can sometimes be re-traumatizing for survivors. When working with survivors, caregivers should establish whether each survivor keeps kosher and obtain such meals as needed. If the survivor exhibits behaviors such as hoarding and hiding food, a caregiver should make an effort to allow this behavior to continue in a safe way if possible. Survivors' trauma can be easily triggered if they need to stand in line for congregate meals or food pantries. Survivors can also become easily embarrassed if they need to express a need for food. Caregivers should never clear away a survivor's meal before they have expressly stated they are finished, and should not throw away food in front of a survivor. Transportation. Like other older adults, Holocaust survivors rely on dependable, accessible, and safe transportation options to get to medical appointments, run errands, and enjoy social activities. However, for survivors, many modes of transportation present numerous triggers, which can cause survivors to relive traumatic memories of being transported to ghettos and concentration camps. Many survivors can experience anxiety or panic attacks when using public transportation or private transportation options like large buses or vans. Drivers of these forms of transportation may also unknowingly contribute to re-traumatization, particularly if they are unaware of triggering word choices, such as asking survivors to line up. Furthermore, while socialization programs are important for all older adults to avoid isolation and the various mental health complications that can result from it, socialization is especially crucial for the well-being of survivors. The symptoms of post-traumatic stress disorder are often exacerbated by isolation, underlying the importance of the availability of reliable transportation options that do not further contribute to a survivor's history of trauma. While many survivors might prefer a private car service rather than larger institutional vehicles, some may prefer to travel in small groups. Therefore, establishing a survivor's transportation preferences early on can help prevent re-traumatization. Caregiving. Caregivers spend a significant amount of time with survivors and play a vital role in their physical and mental health. The need for a caregiver because of age, illness, or weakness can be demoralizing and triggering for many survivors who are often uncomfortable receiving any type of assistance. Resiliency and strength were fundamental to an individual's survival during the Holocaust, leaving many survivors highly independent. Many survivors exhibit common characteristics that caregivers must understand. First, survivors may be distrustful of new caregivers, especially if the caregiver does not speak the same language as the survivor. If trust is not established between the caregiver and the survivor, assistance with activities of daily living can lead to re-traumatization. Additionally, because of the enormous amount of loss they have experienced, survivors are particularly vulnerable to feelings of abandonment if caregivers are tardy, inconsistent, or have high rates of turnover. Caregivers should be aware of survivors' sensitivities and should not take hurtful or distrustful actions personally. Caregivers should use a person-centered approach to build trust with a survivor. Establishing the survivor's preferences, especially as they pertain to activities of daily living support and other forms of care that require physical touch of any kind, is critical. Caregivers should be aware of how tardiness, as well as turnover, may cause anxiety and fear for a survivor, and make plans for how to communicate in advance when such issues arise. Caregivers who are assisting consumers with a move to a new environment should be aware of the risks of transfer trauma. Recommendations for minimizing this risk include preparing them for the relocation and assisting with adjustments after a move is made. Elder abuse is a serious and growing problem for the older adult population. Holocaust survivors may be particularly susceptible to elder abuse because of their elevated risk of cognitive impairment and their experience as victims of trauma. Financial exploitation. Survivors are more likely to be victims of financial exploitation because many survivors are mistrustful of financial institutions. They are reluctant to disclose information about their finances to others. They are unwilling to burden their children with the task of managing their affairs. Additionally, the prevalence of social isolation among Holocaust survivors, particularly due to a lack of familial or other close relationships, can expose them to exploitation at the hands of persons who might take advantage of their loneliness and absence of protective family members. Self-neglect. Some survivors are also at risk of self-neglect due to higher risk of dementia and depression, which might lead to hoarding behaviors and social isolation. Abuse by caregivers. Survivors' complex relationships with their children often come into play in the prevention and remediation of elder abuse and exploitation situations. Survivors' grown children, most of whom are themselves in their 40s, 50s, or 60s, are often involved in providing caregiving, transportation, and logistical and emotional support to their parents. The children of survivors often feel a strong sense of obligation to protect their parents from further suffering. The feelings of obligation to protect a survivor parent can result in conflict between siblings or other family members, and on occasion, allegations of mistreatment or exploitation. In conclusion, Holocaust survivors present a complex series of needs to caregivers. By understanding what the Holocaust was and its lasting impact on the survivors, caregivers can offer a person-centered approach to meeting their needs. The source of this PowerPoint was the Administration for Community Living, January 12, 2017. This article can be referenced for more information on the Holocaust.